Welcome to this edition of the Designs for Health audio science article.
Red yeast rice is neither yeast nor rice, but rather a product of the fermentation of white rice and the yeast Monascus purpureus. It is also a nutraceutical rival to popular statin drugs. The efficacy of red yeast rice as a cholesterol-lowering agent is a function of the constituent monocolin K, a chemical twin to the popular lovastatin. Like statin drugs, monocolins lower cholesterol by inhibiting HMG-CoA reductase in the liver, thereby impacting the rate-limiting step in cholesterol synthesis. However, unlike pharmaceuticals that cannot boast of additional health-promoting components, red yeast rice also delivers polyketides, unsaturated fatty acids, phytosterols, pigments, and at least 13 different types of monocolins. Besides lowering cholesterol, it reduces blood pressure and has been shown to have anti-inflammatory, anti-diabetic, anti-cancer, and osteogenic properties. Collectively, these additional benefits of red yeast rice make it shine as a beneficial nutraceutical for cardiovascular health. A 2017 review gave evidence for red yeast rice's cardioprotective effects by stating the largest randomized controlled trial examining red yeast rice in secondary cardiovascular prevention consisted of 4,870 Chinese patients and showed that red yeast rice reduces non-fatal myocardial infarction, coronary disease mortality, coronary revascularization, and total mortality in patients with a history of myocardial infarction and moderate hypercholesterolemia. Red yeast rice is among the most well-studied nutraceuticals, supported by a plethora of robust studies that have demonstrated its individual effects and compared it to traditional pharmaceutical agents for hyperlipidemia. For example, a 2016 systematic review compared red yeast rice with simvastatin. It included 10 randomized controlled trials involving 905 Chinese subjects with dyslipidemia. No statistically significant differences were observed between the lipid-lowering effects of red yeast rice and simvastatin. The cardioprotective effects of red yeast rice may be a result of its effects on inflammatory factors as well as blood lipid levels. Although this outcome is not as well studied in humans, a 2017 study on apolipoprotein E deficient mice randomly divided into a red yeast rice, simvastatin, or control group showed that the red yeast rice group showed decreased levels of high-sensitivity C-reactive protein, interleukin-6, and tumor necrosis factor alpha, as well as reduced levels of matrix metalloproteinase 9 and nuclear factor kappa beta in the aorta. A previous study on apolipoprotein E deficient mice also showed that red yeast rice significantly reduced intercellular adhesion molecule 1, vascular cell adhesion molecule 1, matrix metalloproteinase 2, and increased serum macrophage migration inhibitory factor. In the same study, red yeast rice was shown to suppress angiotensin II-induced abdominal aortic aneurysm, a chronic vascular disease characterized by medial degradation and inflammation. With the administration of red yeast rice, atherosclerotic lesion areas in both the intima of aortic arches and cross-sections of aortic roots were reduced. Since both dyslipidemia and inflammation are compounding risk factors in cardiovascular diseases, red yeast rice seems to be a dual agent for protecting the heart and blood vessels. Red yeast rice is considered equally effective as pharmaceuticals for lowering cholesterol, and it also may present fewer side effects. In a 2017 single-center randomized pilot trial, 60 dyslipidemic patients were evaluated for muscle fatigue after receiving either red yeast rice or simvastatin. Patients in the red yeast rice group did not experience fatigue or decreased physical activity compared to the simvastatin group. Nearly 10 to 15% of patients taking statin drugs experienced skeletal muscle problems such as fatigue and pain, leading to a decrease in physical activity. Mitochondrial dysfunction is one purported mechanism for this side effect. Additionally, statin drugs have been associated with other secondary effects such as higher liver enzymes, ALT and AST, and increased risk for type 2 diabetes. But a 2014 meta-analysis of 5 trials consisting of 352 patients showed that red yeast rice does not significantly increase blood glucose compared to placebo. The renal and hepatic safety of red yeast rice is comparable to traditional statin therapy, with both showing only a 0 to 5% incidence of kidney or liver injury. Overall, the safety of red yeast rice is comparable or slightly better than that of statins. Poorly manufactured red yeast rice can contain the mycotoxin citrinin, which is linked to several adverse effects, so good manufacturing procedures and quality control is critical. Without doubt, red yeast rice carries strong evidence for its ability to reduce cholesterol and inflammation and potentially reduce risk for compromised cardiovascular health.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.